Today, we are going to break down a huge study from the New England Journal of Medicine. It's all about a powerful new way to fight lung cancer, and honestly, the results are pretty incredible. So let's just get right into it.
So, think about that question for a second, but in the context of cancer. What if you could land the biggest punches against the disease before a patient even gets to the operating room? That is the game-changing idea at the heart of this whole study.
Okay, so first things first, let's set the stage. When a doctor says a lung tumor is resectable, that's good news, right? It means they can go in and surgically remove it. But there's a hidden danger here, a problem that doctors have been wrestling with for decades.
And here's the crucial point. We're talking about non-small cell lung cancer, NSCLC, which is the most common kind. Even after what looks like a successful surgery, you can have these tiny, microscopic cancer cells left behind, and that leads to a really high risk of the cancer coming back. It's a grim situation that has had researchers scrambling for a better strategy to protect these patients.
So, that brings us to the CheckMate 816 trial. The researchers behind this wanted to try something totally different. What if, they asked, we hit the cancer and hit it hard before the surgery ever happens?
There's a name for this. It's called neoadjuvant therapy. The best way to think about it is like this. Imagine you're training a boxer for the biggest fight of their life. You wouldn't just throw them in the ring, right? You give them special training, coaching, nutrition, all before the main event. That's what neoadjuvant therapy is. It's designed to weaken the cancer and stack the odds in the patient's favor before the main event, which in this case is surgery.
The way they designed the trial was actually pretty simple and elegant, all to answer one big question. They took 358 patients with this kind of lung cancer and split them up. Group 2 got what's been the standard of care, just chemotherapy before surgery to try and shrink the tumor. But Group 1, they got the same chemo plus a drug called Nivolumab. Nivolumab is an immunotherapy, which means it basically takes the brakes off your own immune system so it can better find and destroy cancer cells.
Okay, so 5 years pass, the follow-up is done, and now we have the results. The number one question, of course, is which group had more people live longer? Let's look at the numbers.
First up, the standard care group, the folks who only got chemotherapy. 5 years later, 55% of them were still alive. And, for a long time, this was the number to beat.
Now, let's look at the group that got the new combo, the immunotherapy plus the chemo. And wow, the difference is just striking. In this group, 65.4% of patients were still alive after 5 years. That is a huge leap forward. When you see those two bars side by side, it's just undeniable, isn't it? That gap between the blue bar and the red bar, that represents a real, tangible improvement in survival. It means more people are alive because of this new approach.
Let's really put that into human terms, because this isn't just a number on a chart. A 10.4 percentage point difference means that for every 100 people who get this new treatment, about 10 more are alive 5 years down the road who might not have been. That is a massive, massive win.
But believe it or not, the story doesn't stop there. When the researchers really dug into the data, they found this amazing clue that starts to explain why the treatment is so good for some patients, and it all boils down to one specific outcome.
So we need to get familiar with a key term here. It's pathological complete response, or just PCR. This is basically the dream scenario. It means the treatment you gave before surgery worked so well that when the surgeons went in and removed the tissue, the pathologist looked at it under a microscope and couldn't find a single living cancer cell. Nothing. The pre-surgical treatment literally wiped the tumor out.
So, what happened to the patients in that immunotherapy group who actually achieved this incredible PCR outcome? Okay, get ready for this number, because it's pretty staggering. 5 years later, an absolutely stunning 95.3% of them were still alive. Just let that sink in for a moment. Nearly every single patient who had that complete response was alive 5 years later.
And this quote from the study's authors just says it all. It is one of the most powerful sentences I have ever read in a medical journal. Among the patients who got PCR after getting nivolumab plus chemo, not one of them died from their lung cancer in the entire 5-year follow-up. The treatment gave them this incredibly durable, long-term protection.
This is where it all just clicks into place. Look at the difference here, even within the same treatment group. The patients who got the immunotherapy combo but did not get a complete response, well, their 5-year survival was about 56%, which is basically the same as the chemo-only group. But for those who did get a PCR, survival just skyrockets to over 95%. This tells us that PCR isn't just a good sign. It's an incredibly powerful early clue that predicts long-term survival.
So, let's wrap this all up. Let's zoom out. What's the big picture here? What does the CheckMate 816 trial really mean for how we treat lung cancer from now on?
It really all boils down to a few critical things. First, this trial pretty much establishes a new standard of care. Full stop. Second, it proves that adding immunotherapy before surgery saves lives. Third, it shows us that PCR is a super powerful early clue for how a patient's going to do long-term. And finally, this approach provides lasting protection, stopping the cancer from coming back, not just where it started, but in other parts of the body too.
At the end of the day, the conclusion here is just crystal clear. This pre-surgical approach, this neoadjuvant strategy, it isn't just some small improvement. It's a method that can totally change the course of a patient's life, giving them the absolute best shot at a cure when it's followed up by surgery.
And that leaves us with this really exciting question for the future, right? We now know that PCR is this amazing predictor. So could we use that early clue, maybe along with other things like super-sensitive blood tests, to one day perfectly tailor treatment for every single person? To know right up front who might need more treatment after surgery, and just as importantly, who might not? That is the next great frontier that this research has helped us step into.